Good afternoon. Thank you all for being here today on Monday. We know that Mississippi is still battling the deadly coronavirus. I will tell you that, and it's all anecdotal, but I have seen a tremendous amount of participation and increased focus from the people of this great state. It makes me more and more confident that we can and that we will emerge from this virus even stronger. Mississippians, by and large, are stepping up. They are taking extra steps to protect themselves and to protect their families. All of us know somebody who is vulnerable to death from this virus. We all have the ability to suffer tremendously, and it takes all of us working together to prevent those tragic outcomes. Our order on bars went into effect this weekend. I'm looking forward to examining the data to determine the outcome of that effort. We know we're not going to see tremendous progress over a 24 or 48-hour period. It is a combination of a large number of things working together that will help us slow this virus. We know that a large amount of our spread has been occurring amongst young folks, amongst folks who attend bars, and amongst folks who often are making reckless decisions. Combining alcohol and close quarters is a dangerous proposition when it comes to this virus. I'm looking forward to reviewing the school reopening plans, those that are due at the end of this week. I'll be researching and reading them closely. We know that it is essential for children to get a quality education, especially after missing so much time in the spring. Think about it. For some of our kids across Mississippi, they have now gone 5 months without any significant learning opportunities. March, April, May, June, and July. We cannot allow those kids to fall further behind. We also have to work to provide the safest possible environment. All of that work is ongoing and urgent, and I look forward to seeing the plans that are put forth by various districts. I've heard anecdotally that this district is going to do this and this district is going to do that, and some say they may not let kids back in their schools for a long, long time. I want to see what every different group puts together, every different school district, and we'll make decisions accordingly. If we have learned one thing over the last 6 months, it is this: we must not ignore the risk of the virus or the risk of shutdowns. Both paths carry heavy, heavy cost. We must be willing to be innovative, and we must be willing to think outside of the box. We cannot do things the way they've always been done. Apathy is the only thing that is off the table at this point. Oftentimes, many of you ask me in these press briefings, would I consider X? Would I consider Y? Would I consider Z? The answer to your question is going to be yes. I would consider anything that I believe will help slow the spread of the virus so that we can more quickly get back to a more normal environment for our young people and for all 3 million Mississippians. With that, I'm going to turn it over to Dr. Dobbs to give us an update.
Thank you very much, Governor. Today we're reporting 653 additional cases with 6 more deaths. Wouldn't be too comfortable with the 600 number. We frequently have a little bit of a drop after the weekend, so we'll just follow subsequent days to see what's happening, but certainly would not take this as an indicator that we've seen much improvement yet, although certainly we can be hopeful. If we look at what else is happening in the state, if we look at our hospitalizations, we still can see some tightness within the hospital bed availability, although it does seem to be stable. We have 9 major medical centers in the state with 0 ICU beds available. One of the things that's been very helpful is we've seen over the past week, we have over 300 less non-COVID patients in the hospital, making room for more and more coronavirus patients. And so that has helped out somewhat we've had a more modest decrease in non-coronavirus ICU patients. It's 21 less this week compared to last week. And for our coronavirus patients, we've had a modest increase over a week from 293 to 304. An increase, but not, stratospheric sort of rise. And relative stability in our floor bed patients, so people not in ICU, from last week it was 942, and this week it's 949. A couple things I think that are worth just mentioning real quickly. We have been looking at our information, and I've been personally calling different coronavirus patients who we've identified in the past week to get a sense of what's going on now with who's getting coronavirus, how they're feeling, and how did they get it. A lot of folks that I talked to this morning had pretty common symptom complex, and a lot of them was pretty bad. They had a high fever, body aches, severe back pain, which is something we've seen quite a lot, especially when we were looking at the Capitol Complex outbreak. And then certainly people who've lost taste or smell. If you have a sudden loss of taste or smell, it is almost certainly going to be coronavirus. That's about the only thing that's going to do it to you. Some people were more sick than others. Some were hospitalized, some were not. But if we look at how do people get it, pretty clearly there's some common threads that we've identified. And the most common thing that we've seen, about 80% of the time, it was a social gathering where people let their guard down. It might be a funeral. It might be an extended family get-together. You're not going to wear a mask around your cousin who comes in from out of town. It's going to be with nephews. It's going to be going to maybe a close friend's birthday party. Those sorts of things are what we're seeing. So it's not even so much nuclear family, unless someone goes out and goes to a social event and brings it back. We'll try to do more and more sort of numerical analysis, but the social gatherings really do seem to be getting us. Of course, there are work exposures and things like that, but it's the social gatherings where we let our guard down and we feel like, it's appropriate for me to be more personal, to breathe other people's air, to touch other people. And sometimes they're not very large gatherings. Sometimes it's 5, 10, 15 people, so it's not like it's a massive group of folks. So really just please be very careful right now. Mostly stick to your own nuclear family as much as you can. And if you're around other people, remember, there's a good chance that one of those folks has coronavirus, and we need to take every precaution while we get through this current surge so that we can hopefully be in a better spot in the next few weeks. Thank you, sir.
Thank you, Dr. Dobbs. At this time, I'm going to turn it over to Director Michelle, who's going to give us an update from the emergency management perspective.
Thank you, Governor. Good afternoon, everyone. We are rapidly approaching August the 3rd, which is going to be the open application period for the COVID-19 County and Municipality Emergency Relief Fund. We have a couple of things that we're working on that will also come about on the 3rd of August. I'll be providing more information the later we get in the week, but bottom line is our help desk that we've talked about to help walk counties and municipalities through that process will be open and operational on the date of our application period. And again, that application period will run from the 3rd of August until the 15th of October. It is important that you do your planning up front. Don't rush putting your packets in early on, but I certainly recommend that you get those packets in well before the end of the application period so we can get through those applications quickly and get money to you in the most expeditious manner that we can. Second thing, just a reminder that FEMA is conducting webinars. They started today. They will run every day this week to assist counties and municipalities with the public assistance process. Those of you that are not familiar with that, FEMA is trying to assist and help with the familiarity of the PA application process. If you're not able to make those webinars, there will be videos available. All of that information is available at MEMA's website at msema.org. And then finally, this tropical update. Our tropical storm that we were watching, Gonzalo, dissipated this weekend, so that one is no longer a threat to us. We are watching an IVAS system way off the coast of Africa that is moving. Currently, the models on that are projecting it to move off into the Atlantic, but we'll continue to watch that over the next few days. So hopefully, other than some rain throughout the remainder of this week, going into the next week, nothing thus far. We'll keep our fingers crossed. Governor, that completes my update, sir.
Thank you, Director Michelle. I do also want to just point out one thing that either has been announced or will be announced later today. We have worked with the United States Treasury Department, and I want to personally thank the Trump administration as well as Secretary Mnuchin and his entire team. We have gotten approval for a Restore Act grant award of $6.67 million for and to support Pearl River Community College's Workforce Training Center in Hancock County. This is something that I am exceptionally pleased to announce for a lot of reasons, one of which is it was Senator Moran and I back several years ago that worked with Pearl River Community College to initially acquire the land on where this Workforce Training Center will go. To me, this is a prime example of why it's so very important for the governors to have the ability to work with local officials, to work with the federal government, to leverage all resources to maximize our investments in our communities throughout Mississippi. It's the very reason that Senator Moran and so many other great state senators on the Mississippi Gulf Coast have been fighting to make sure that we maintain that. It is that fight that has led to the Department of Marine Resources on the Mississippi Gulf Coast having been shut down, unfortunately, but hopefully we'll be able to get the legislature back in sometime very soon. We'll get DMR's budget passed in the same way that the House passed it during the regular session, which is the way in which the Senate wants it to become law, as I appreciate it. But again, this is just an example of every person on the Gulf Coast benefiting from the Restore Act and benefiting from the Department of Environmental Quality and the governor having a relationship with the Congress as well as the Trump administration. So again, I want to thank everyone that's worked hard on this. It's going to be a big deal for workforce training in Hancock County, and I could not be more thrilled than to announce that today. With that, I'm going to turn it over to any questions you may have. Yes, sir.
Thank you, Governor. I'd like to start with Dr. Dobbs, if I may. Doctor, you tweeted earlier today a common COVID myth that you see on Facebook. A father goes to a clinic, waits a few hours, ends up not being tested for whatever reason, and then it gets a call the next day that it's positive. Can you dive into, is that something we're seeing today? And you said stage 1 is ID the patient, stage 2, review state database. What exactly do those mean? And can you tell me what stage 3 is?
Yeah, so, you know, we want to look at these things as they come up. I mean, sometimes they could be legitimate, right? And so, or sometimes it might just be sort of like urban legend sort of stuff. So we've seen this one over and over again. It's almost identical with a different person or maybe a different number of people. But so there was someone that we got a report on, and actually it was a Facebook post that had a name attached to it. And so, okay, great. And it's somebody in Mississippi. And so we validated who the person was. We made sure and review our case database to see if it was a reported case, and it was not. There was no person with that name who was reported as a case. So I know I guess it's a theory that we're creating false cases, right? So anyway, that one was not counted. And so now we're going to try to track down and see, was it just a clerical error in the office? Did someone call the wrong person with a positive result? So we want to just kind of take it through the steps, because if there are errors in the system, whatever they are, we want to correct them. And so at least on the first phase, it's not getting to us as a positive case, so it's not artificially inflating the numbers, but we'll trace these down. And if you have more of these stories, we'll track more of them down to see, is it a quality control issue at the clinics, and is that something we need to look at, or is it maybe just maybe some of it's not true? And so we'll keep looking at it. So send us, if you see some, send it to us. We'd like to check them out.
What is stage 3 then? You said stay tuned. Can you tell me now?
Oh yeah, so we'll try to contact the individual and find the clinic and see what happened narrative-wise, and maybe they did make a mistake and call the wrong person. That certainly could have happened.
So these errors have happened before, possibly, just not with that individual?
Not that I know of, but we're going to track it down.
Governor, you said earlier this month that counties that met a certain criteria, 200 new cases or 500 cases per 100,000 people over 2 weeks, would be considered hotspots in the state, and as such would face greater restrictions to curb the spread of the virus. On Friday, our analysis using your metric showed 24 counties that met that criteria, yet you only selected 6 counties for mask mandates. Why establish criteria and only use it for 1/4 of the counties that actually need it? And I've got a follow-up after that.
Sure. I haven't seen your analysis, but the data that we are looking at, that we looked at last week to make that decision, was actually data from July 1 through July 13th. We look at it in 2 ways. We look at it on a 2-week basis, and then we also review data based upon the last 7 days. Again, for us, the data that we have over, say, the last 3 or 4 days, we like to look at date of onset of illness rather than number of cases that are reported, because we've had a large number of cases over the last really, quite frankly, 6 weeks. What we're finding is it's taking our team a little bit longer to get that date of onset of illness because we got so many other people that we're calling into. And so the data that we utilized last week to announce those 6 additional counties was all data from June 30th until July 13th. And so that's what we're looking at. We have looked at data this morning, in fact, and most of the day, which takes it from 1 week after that. And there are 9 additional counties that potentially will fall into that category based upon those 2 weeks. We are not announcing that today, but we very well may over the next 2 or 3 days as we look at what happens from a number of cases, whether or not we'll add those 9 additional counties. To give you a couple of examples, Coahoma County is not currently on the list, but I would anticipate that it will be very, very soon. And so, again, we feel very strongly that everyone across the state should be wearing masks. But now, if you're in Coahoma County, I'm not adding it to the order yet, but it's very near being added. In addition to that, you're looking at a county like Jones County, which very well may end up on that list within the next day or 2 or 3, depending on what the numbers do. One of the things that I'm personally looking at, and I haven't even talked to Dr. Dobbs about this, one of the 9 counties that shows up on the list today, based upon the criteria that we have, is Issaquena County, for instance. It's because their population is so small. They literally had 7 cases over 14 days, but yet that doesn't put them near the 200 over 14 days. But even in a small population county like that, 7 cases puts them over the 500 per 100,000 residents. And so we're going to have conversations about those. But again, if you live in Mississippi, it is my recommendation that every single person wear a mask when in public and continue to socially distance. I think that's important. I think it's extremely important. We are beginning to see some evidence that some of our measures are working. And in fact, if you look at the hospitalizations, for instance, the decision to look at elective surgeries, as Dr. Dobbs has said, we have quite a few fewer patients in hospitals throughout Mississippi for non-COVID related reasons. So that's beginning to work. I think we're seeing in some counties where participation of mask wearing and really just overall people paying more attention is hopefully beginning to have some impact. But as we always say, a decision that we make today, you start seeing the impact hopefully within 2 weeks from now, but it could be 3 or 4 weeks. So you're talking 20 to 30 days after a pronouncement is made. But generally speaking, what I've seen is over the last 6 weeks, Mississippians are much more cognizant. We as a state, we as the Southeast, quite frankly, we as a country, I would argue, sort of started ignoring the virus right around when the protests started in late May. And for much of June, this whole country talked about lots and lots of things other than talking about the virus. That's true across the country. It's certainly true in Mississippi. I think a lot of people let their guard down. And what Dr. Dobbs said earlier, which I agree with 100%, is much of the spread has been caused over the last 6 weeks or so because individuals did let their guard down. And there's lots of different factors and lots of different reasons, and every single person I know wants to point to one thing. Well, this is what we should have done, or this is what we should do, or this is why we are where we are. Anyone who says that's wrong, because it's not any one factor. It's lots and lots of factors that have put us where we are, and it's going to take lots and lots of good people making good decisions to make this thing roll over and start coming on the other side.
So just to reiterate, I want to make sure that we're on the same page. So the criteria is correct in terms of the 200 or more and the 500, but the date is key here, and you're looking at onset in some cases. And if I hear you correctly, that the date range you've chosen for these restrictions would actually be 2 weeks ago, right? I mean, it was June 30th through July 13th. Today's the 27th.
Right, so
not
we
as
started,
close.
I would say it's about a week behind is what I would suggest, because it really, we started looking at those additional counties at the beginning of last week, so at Monday and Tuesday. And so it's 2 weeks ago today, but when we started looking to it, it was a week ago. But yes, it was. And so what the data I'm looking at today is more new data, which includes 9 additional counties in addition to the 29 we've already put in place. Again, of those 9, I think 3 or 4 of them, and I'm not looking at it right now, but 3 or 4 of the potential new counties are due to total number of cases. 5 or 6 of them are much smaller counties that are due to the 500 per $100,000 limit. So,
Once those 9 are added, I didn't catch up.
no, go ahead.
Once those 9 are added, you're looking at 38, almost half the state. At what point do we just pull the trigger on a statewide mask mandate at that point?
Well, what I would tell you is that currently today, my estimation, if you include both state orders as well as local orders, well over 2/3 of Mississippi's population is currently under a mask order of some sort, because you've got many of the larger municipalities who put one in themselves. There is no guarantee. You've heard me say this before, and I'll say it again. I really firmly believe that a statewide mask mandate in Mississippi gives not only local elected leaders, but also people throughout our state. You know, if you live in Tishomingo County and there's a statewide mask mandate, you can't help but say, well, that's probably from those folks in Hancock County. If you put a statewide mandate in, the folks in Hancock County are going to say, well, that's for those folks up in Tishomingo County. They can't possibly be talking about me. And so I really believe that this more surgical approach is the right way to go. Today marks about just shy of 3 weeks since we implemented the initial mask mandate for Harrison and Jackson counties. And so, I think we've got to be willing to let the orders that we put in place work, and that's something that we're certainly trying to allow for.
Dave Elliott with WLOX has a question.
Thank you, Renee. Governor, you've talked about this July 31st deadline for school districts to have their plans submitted. Well, that's in just 4 days. We've seen all the plans down here, so I presume most from around the state have already been sent to Jackson. As for the review process, how much authority does the Department of Education or your office have to approve or reject plans? And what do you think about the Mississippi Association of Educators calling on state leaders to provide guidance rather than leaving it up to individual districts?
Well, thank you for that question, Dave. And honestly, when I say that your first question is a good question, it is a good question in terms of where we find ourselves. It has long been the view of Mississippians that we believe in local control of education. That's the reason we have approximately 138 local school boards. Fortunately, that's a lot less than the 152 when I started as lieutenant governor, because we've been trying to reduce those numbers, and we should continue to lower administrative costs and put more money in the classroom. But at this point, the local school districts have an immense amount of flexibility, but unlike the school year that just ended in 2019-2020, I do not anticipate that the State Department of Education is going to waive the 180-day rule. And so for those individuals who think that there's not going to be repercussions or school going much longer than what otherwise would occur in late 2000 or in the middle of 2021, I think that they've got to understand that rule is not likely to be waived. In addition to that, we have seen a number of the school district plans. Some of them look very good, some of them do not. I find it just absolutely interesting that the association, the teachers union in effect, has now decided that they want the state to make decisions. But what I will tell you is we're reviewing every report that's come in, and we're going to make a decision later this week or early next week on what we think the best course of action is. What we may find is that there are enough school districts that have good, strong, solid plans in place that we will that we won't have to opine on it. We prefer for every school district to have a good, solid plan that gets kids back in school in a safe, responsible way. Now, again, I haven't personally reviewed all of these yet, but some of the anecdotal evidence that I've been hearing, there appears to be a lot of, shall we say, a lot of work left to do in many of the school districts based upon the plans that they have submitted. But again, I'm not going to talk specifics until we can get everyone's plan in, and then we can go from there. Yes, sir.
Thank you, Governor. Coming to a few of these meetings, it just seems like I'm hearing a bit of mixed messaging. So if you could clarify, you do say, Mississippi wants to leave it up to local control. Now you're saying that they're going to send you these plans. Is there authority that you or the state does have to tell City of Jackson, for example, that they can't go full digital when they did say they already would, or vice versa with any other county?
Well, what I am committed to is I am committed to making sure that every kid has an opportunity to learn in 2020, 2021, and that every plan that every school district has submitted gives every kid the opportunity to see academic improvement in both the short, the intermediate, and the long term. And so I do not want to issue any executive orders. I do not want to use my emergency powers to ensure that is the case. I want to have confidence in our local school boards to make the best decisions for Mississippi kids. But I cannot sit idly by while some school districts are educating kids and others do not have plans in place that can both protect the kids as well as make sure that they are seeing academic progress.
So you would not overrule a move. You're saying you're not going to overrule any move to overrule a school district if you disagree with how they're going to open?
No, I did not say that. What I said is I don't want to do that. That doesn't mean that I will not do it if I am convinced that they are not acting in the best interest of Mississippi kids.
Nick June with Jackson Free Press has a question.
Hi, yes. Quick follow-up to Alex's question there, and then I want to have Dr. Dobbs. Governor Reeves, have you reviewed Jackson Public Schools' plan to go virtual only, and do you think you might, in a sense, veto that plan?
I have not reviewed it yet. I've heard anecdotally that they're going to go virtual only. I'll have to review exactly what they're saying, the length of time that they're saying they're going to do that, and quite frankly, I want to also see what sort of academic progress they made on a virtual only basis in March, April, and May. That's critically important because there are school districts that are going to be able to adequately show that kids made significant progress on a virtual learning environment, or they may also be able to show that the kids that were not able to be in a virtual learning environment, but the district were to deliver packets of information, etc. There are a lot of kids who learned in March, April, and May in Mississippi, and so it's a combination of here's what we're going to do, but also here's where we were successful in March, April, and May educating kids. For me, it's all about, are we going to continue to see educational attainment improvements by Mississippi kids?
Thank you. Dr. Dobbs, I spoke to the superintendent of Madison County School District today. They pushed school back to early September due to the increased spread of the virus. When I asked what specific metric they're looking for to determine that a traditional return to school is safe, she said that they'd like specific guidance from MSDH on what would determine that. So I'd like to ask you, are we looking at total cases per capita, case positivity rate? Is it more than 100 cases per 100,000? What is the metric schools should be looking for to separate a safe reopening from an unsafe one? And what should that metric look like?
It's a really difficult question. I'm not sure there's a precise answer to it, to be quite honest. And I think part of the answer is what type of school scenario are you looking at? if you have a classroom that has space for kids to be apart, and there's masks and there's a good plan, using some of the sort of guidances that we've shared, I think that makes it a lot easier to open up without as many concerns. I will just say right now there are too many cases for us to all feel comfortable. There's too much transmission in the community. There are going to be when kids open up when we open up schools, if we're not careful, a dozen, 2 dozen kids walking through the door are going to be contagious the day that school starts at every school. And there's nothing you can do about it because that's just what's going on in the community. So it's really important for us to take this opportunity right now. The incubation period for the virus is such that if we really knuckle down for a couple of weeks and really let our communities have a breather so that there's not so much transmission going on and our kids are not getting infected, it's going to make it so much safer for kids to go to school and for the teachers and for the families of the kids. So not an easy answer. I don't think there's a number that we would feel good about. The number we have right now is not a comfortable number. But the other side of that equation is what are you doing? I mean, clearly you can't have football stands full of people right now. That would be absolutely disastrous. But you might be able to have some other school environments that are going to be safer if the distancing, the masks, and the hand washing and the order make a big difference. But I think it's just going to be an ongoing collaborative effort, and we'll be very happy to kind of help give that guidance with the school systems.
One thing I would like to add is, and this is human nature, but the question that Nick asked, it seemed to me came across as when can we go back to doing school exactly the way we always did it before there was a virus? And my point to everyone that is making decisions at the local school board level is it's not normal times. We have to be innovative. We have to think outside the box. We have to be willing to say, perhaps, and again, it varies from a district to district, but perhaps we can put kindergarten through 6th grade in our schools. We can spread them out while allowing for virtual learning at least for the next couple of 3 weeks or 4 weeks for 7th through 12th grade. And I'm making this up to a certain extent, but I just want to reiterate that at this point, until we get every school district in, please don't be thinking, when can I reopen my school district in my school building in exactly the way it was on August the 15th of 2019. That is not the correct mentality, because you can open up schools in a safe way, but it may not be exactly the way your school building looked in the middle of August of 2019.
Stella Yu with the Commercial Dispatch has a question.
Hi, this is a question regarding the counties that are placed under tighter COVID-19 restrictions based on the criteria that were just mentioned. So this is for Governor Reeves, but Dr. Dobbs, please feel free to jump in as well. And I have another follow-up after that. So Lowndes County supervisors, so I report in Lowndes County, the supervisors today passed a resolution asking you to place the county on the list of counties with tighter restrictions. So according to data from the State Health Department, the county has seen 263 new cases in the 2 weeks between July 11th and July 25th, which is more than 200 new cases. Now that matches one of the criteria you previously mentioned for counties to be on that list. So my first question is, why isn't Lowndes County on that list yet? And would you agree to place it on that list based on what the data shows?
Well, thank you for your question. There is no law which forbids Lowndes County supervisors from having a mask mandate if that's what they would choose to do. And so while I appreciate them asking me to do it, they certainly have the ability to be the bad guy too. And bad guy is in quotations, of course. They can do a countywide mask mandate if in fact that is what they want to do. Having said that, in the June 30th through July 13th timeframe, Lowndes County did not meet the criteria of at least 200 cases. My understanding is, in the new data that I received this morning, that they appear that they have exceeded that over a 2-week period. However, obviously we're not adding counties today, but as we look over the next 2 or 3 days, it does appear that Lowndes is one of those 9 counties that has come into effect. And so what I would say to you is, regardless of what I write on an executive order, regardless of what the Lowndes County Board of Supervisors writes or ask anyone to do, if you're in Lowndes County, you should wear a mask. If you're in any other county in our state, you should wear a mask. There's no question that Lowndes is, much like Lee County, also not far from you, has seen an increase in the number of cases. And by the way, I believe that both the city of Columbus and the city of Tupelo have had mask mandates for weeks and weeks and weeks and weeks. And so, contrary to what everyone wants to believe, which is, oh my gosh, if we'll wear a mask, it'll be over tomorrow. Wearing a mask, staying socially distanced, not going to into large crowds is what we need to be doing right now. Certainly, Lowndes County fits the criteria as well.
Thank you. I do have a quick follow-up. So, since more updated data does exist on the NSDH's website, but why does the state use the data between June 30th and July 13th?
Well, that's what we used last week. This is a new week, and so we're looking at the updated data. Understand that we have to be consistent with the way in which we analyze the data. Because if we weren't consistent with the way in which we analyze the data, if we just wanted to pick data points on a day-by-day basis, then what I would be doing is I would add a county today if they went to 203, and then if one day fell off tomorrow that happened to be a bad day and they went to 198, then I would then be taking them off of the mask mandate. And so what I would suggest is give us a couple of days to analyze the data. Let us see some consistency, that those numbers stay over the 200 mark for a period of time. And if it is appropriate, we will add the county to the mandate at the appropriate time over the next several days.
Jack from Clarion Ledger has a question.
Reeves, earlier you were talking about how if you ordered a statewide mask mandate, it could discourage some folks from wearing masks, folks who think that it doesn't apply to them or that it applies to different counties. Can you just maybe expound on that a little bit more? Because when you say that a statewide mask mandate could discourage some folks from wearing a mask, that just sounds a bit confusing to me.
It is my opinion that what we are dealing with is we have to be very smart about convincing Mississippians that wearing a mask is the right thing to do. Now, keep in mind that back in March, the World Health Organization and a lot of otherwise really smart people said that wearing a mask would do you no good. And so, that being the case, there is a segment of our population that is naturally skeptical that this or any other measure will actually have any effect on the spread of the virus. And so, what I believe is it is my job to go about dealing with this virus and making decisions for the state that are well-reasoned, that are well thought out, and that ultimately lead to the most possible Mississippians adhering to measures that have the most likely impact that we want them to have. In other words, we want as many people as possible wearing masks in public, staying socially distancing, staying away from other people in large crowds, and I believe that this surgical approach of naming counties based upon an objective criteria is the best way for us to get the maximum amount of participation in Mississippi. Now, keep in mind, I understand that a lot of you think we can just snap our finger and all of a sudden 100% of the people will comply and everything will be great. But you also have to remember that there was a time when, if you looked at the models The University of Washington model, for instance, the difference in outcomes based upon whether you had a shelter in place or if you didn't have a shelter in place was hugely different. Now, if you look at the University of Washington model, a shelter in place is not even an option. It's not even in the data. Now it's, do you have a statewide mask mandate or no statewide mask mandate? Which says to me that there has been no panacea of a decision that can be made that just completely eliminates this thing. What we're trying to get people to do is to understand that it's complicated. There's nothing easy about it, but we do believe that if you will practice social distancing, that you will not gather in groups of more than 10, if you will wear a mask when in public yet still socially distance, that is the best way to minimize the risk. There is no such thing as eliminating the risk of the spread of the virus unless every individual can live in their own house and never leave their own house, and that's just not practical. And so while I understand that some of you believe that if I will just opine that this statewide mask mandate is the right thing to do, that the virus will go away, just like when we sheltered in place for 3 weeks in April, the virus didn't go away. It helped us slow it. This is the best measure for us to see the maximum number of Mississippians participate, to buy in, to do what's best to slow the spread of the virus, to protect themselves and protect their neighbors, and that's the reason we've enacted it.
Taylor Vance with Daily Journal has a question.
Thank you, Renee. I have a question for Dr. Dobbs and Governor Reeves. I know that the two of you have previously shared your opinions on the possibility of high school sports and athletics and other activities, but I was just curious, do you mind just weighing in and sharing some of your thoughts and perspectives on the safety of university athletics and activities which could potentially start around September?
Yeah, well, thank you for your question. And let's be honest. We can't talk in generalities about college sports or high school sports because every sport is different. For instance, there's a huge difference in a cross-country track meet and a high school football game that typically would draw thousands and thousands of people to the stands. There is something quite different between a women's soccer match on the campus of Ole Miss or Mississippi State and a college football game on Saturday that typically would draw 75,000 people. And so what I would tell you is that it is highly unlikely that it is going to be allowed, and the universities know this. I've spoken with the university leadership throughout this entire process, including multiple meetings in the last 10 days with our university leaders. We're not going to have college football in which 100% capacity is allowed into our stadiums. The university leaders that I've spoken with are very committed to trying to find a way to have college football. I think we will have college football. It may be a delayed start, but it's not going to be with 100% capacity. The question is it 10% capacity or 20% capacity or 35% capacity? But those are the conversations that are being had now, and it's got to be done in a way where, for instance, there are multiple entrances to the stadium that are open, and that people have the ability to enter the stadium hours in advance of the game, because you certainly wouldn't want, even if you had, let's say, 20% capacity on a 70,000 seat stadium, that would be 14,000 people. You don't want 14,000 people going into the stadium at the same time, so you'd have to spread it out over several hours for them to enter into the stadium. And so is there a way to do it that is more safe than others? Yes, but it's complicated. It's going to take a lot of conversations, a lot of discussions, an awful lot of negotiating on what makes the most sense on a university by university basis. And we are having those conversations. We're not ready to make an announcement at this time, but there is no doubt that Dr. Dobbs and I and the university leaders have had untold number of conversations over the last month or so with respect to this.
Yeah, and at this specific moment in the pandemic, it's a bad idea to put a lot of people together. We all need to buckle down and beat this thing back, and it's easy to do. And then maybe, it'll make it a lot easier to make some of these tough decisions going into sports. I watched baseball all weekend. It's different without fans in the stands, but I can't imagine. I went to several Major League games last year, and if there were coronavirus in the air when we did that, as crowded as it was and as packed everybody was together, we'll have to be very thoughtful and methodical about how we approach it, especially because I think we've learned time after time is that people let their guard down. And we've got to be careful that if we're going to do something, we could have come through this very nicely if we had strictly followed the rules and been very thoughtful about wearing our masks and, not socializing back in the end of May, but we just didn't have the composure to have any discipline about it. So there's a lot of conversation that's going to go on about it, but if y'all want football, if you want to be able to do the things we normally like to do, don't do the things that spread COVID. It's pure and simple. If every time we spread coronavirus around, we make it that much less likely that we're able to do the other things in life that we enjoy.
By the way, just to be fair, I mean, we are having these conversations internally every single day, but it's not unique to Dr. Dobbs, Tate Reeves, and the university presidents and athletic directors in Mississippi. Every single state, they're having these exact same conversations. Different states are in different spots today, but you're seeing lots of decisions, and the decision as to whether or not the student athletes play, certainly at the collegiate level, is more likely to be made at the university and the conference level. The number of people in the stands, if any, is likely to be made by the leaders in each state. And so the bad news is, if college football was kicking off tomorrow, it's not likely that there will be very many people in the stands. The good news is college football is not starting tomorrow. And if it's 7 weeks from now, 8 weeks from now, we can make a significant difference in what it looks like when they kick off, if and when they kick off, by doing the little things today. By wearing a mask in public, whether you're in Lowndes County, Lee County, or Hinds County, you can make a difference in whether or not we have crowds at college football, and quite frankly, whether or not we have college football or not.
Yes, sir. Thank you. Dr. Dobbs, going back to some college sports, I guess one thing to add real quick, a lot of people think, if we're in these outdoor stadiums, the air will blow COVID, away and not directly to me. So I can see you're shaking your head. One, can you talk about the threat it would be if fans were in the stadiums, and when fans come, should the universities require them to wear masks if they come into these stadiums?
We have numerous instances of outbreaks and transmission outdoors. Certainly, it's kind of like the summer was supposed to make coronavirus go away, right? I mean, it probably did make it a little bit better, believe it or not, but as bad as it is, it probably would have been worse. Proximity to other people, and then loud voices. There's kind of loud voices at a ball game, as I recall. And so whenever you have somebody, that really spreads it a lot. So yeah, it's a little bit of a mitigating factor as far as outdoors. It's a lot better than being indoors, I give you that. But if we're going to put 10, 15,000 people in some stands, and when they go to the bathroom, when they go to the concession stand, or when you're coming and going and you're congested at the entrance and exits, those are high-risk endeavors, and those things are going to have to be looked at. So the best thing to do is to have as few people in the crowd with coronavirus as possible. But masks, distancing, very careful engineering of seatings and all that sort of stuff would be absolutely required, I think, to even think about doing it safely.
So if I may have a follow-up real quick, if we realize that it's not fully safe for the fans to come into the stands, why would it be fully safe for the players, especially in contact sports like football and soccer, when you are in close contact and sweat, breathing, etc.?
Yeah, there would be some risk. There's no doubt, and there's ways to mitigate that risk, like everything. But I will tell you that in all the outbreaks we've seen among football players, they all got it at parties after hours. or at bars. So I think the bigger thing is where people are getting it, and people are getting it when they're socializing and when they're hanging out. So I mean, it is something, a risk that would need to be mitigated, and it would be something that needs to be managed. And I know some of the colleges are going to be into real intense testing like they do in the professional areas, and that does have utility as far as creating a bubble. But yeah, there have to be precautions taken for those guys too.
Tell you a story that I was told, and again, I've been kind of busy focused on Mississippi, but as I appreciate it, the football team at LSU came back and spent a great deal of time together, and they practiced and they lifted and they did some of the things that they did, and then a large number of their players started getting coronavirus, and it was, as I appreciate it, again, don't quote me on this, but as I appreciate it, it was a large number of players had left the confines of that tight-knit group, gone to downtown Baton Rouge and had a good time, and that's where some of them got it. And then, of course, once they went and got it, it spread throughout the team. Testing is going to be critically important to protect the players, obviously.
David WLOX has another question.
Yeah, Governor, I want to go back to K through 12, because if I'm getting emails from parents and teachers every day, I know you're getting thousands of them. If teachers are able but unwilling to go back out of health concerns, in your mind, what is their obligation to return? And what about students if their parents opt out of in-person school and they're not prepared or interested in distance learning? Is that child in danger of simply being left behind?
Well, again, we're gonna see what the return to school plans are for each of the districts and make decisions at the time. My impression is that teachers have contracts, and I presume that all of our teachers would want to certainly honor the contracts that they've signed to get paid if they're willing and if they're able to do so. With respect to kids, I think it is the best case scenario is that individual school districts offer more of an option for parents whereby the kids can learn in the classroom, and or some kids who may be at particularly high risk have online learning options, and I think that many of our school districts will offer that so that kids whose parents are at home and have the time and the ability to make sure that their kids are learning, that they have the opportunity to do so. But that's not a particularly good option for an awful lot of families across Mississippi who have two parents who work. And so, I think that we can be innovative. I think we can think outside the box, and I think we can develop a plan where every kid can see academic achievement, academic improvement in the fall of 2020. But we've got to be willing to think outside the box, and that's the reason I'm trying to stress to those who are going to be those school districts that are going to be turning in their plans here shortly. If your only option is, hey, when can I return back to school in exactly the way I did it a year ago with exactly zero risk, then you may not be putting kids back in school for the rest of these kids' lives. And that's certainly not an option that anybody believes makes very much sense. And so we've got to be, we certainly don't have all the answers today, but as we progress over the next several days and weeks, that's where our mentality has to be is, can we lay out a plan where every kid has the ability to learn? And that's critically important.
Governor, I wanted to ask you about a couple of concerns from some mayors, including Jackson and Tupelo, saying that outside these press conferences, your office does not and has not communicated effectively with them during this pandemic. What would your response to that be?
Well, what I would tell you is we have worked very, very hard to communicate weekly early on and pretty regularly with mayors. You've got mayors like the one in Tupelo who has decided that he'd rather play politics in the middle of this pandemic than than actually focus on doing what's right for his constituents, and that's certainly his prerogative. He wants to attack, and quite frankly, play the blame game. Look, there'll be plenty of time for the blame game. There'll be plenty of time for us to look back and say, well, maybe we should have done this or maybe we should have done that, but now is not the time. When you're in the middle of a pandemic, the likes of which we haven't seen in over 100 years, anybody that has any sense is going to put politics aside and focus on doing what's right for our constituents. Because I can tell you, this virus, it doesn't care about politics. It doesn't care if you're a Republican or a Democrat. It doesn't care who you voted for in the 2019 election. It doesn't care if you are a politician trying to gear up to run for something next year or 2 years from now. It is dangerous, and what I've got to focus on is doing what I believe to be in the best interest of all Mississippians. And while there are always going to be outliers, I don't know if it was you that asked me the question, but a number of press were asking about the criticisms I was getting from the Moss Point mayor there early on. Only thing I would tell you is I think if you spoke to every elected official across the state, what you would find is the vast majority of them have appreciated how much we have communicated with them, how open we have been, how honest we have been, and how we've tried to meet the demands of all of our constituents, regardless of political affiliation or geographic region of the state or otherwise. And so, look, I've been doing this a while, and there's always going to be those outliers who want to criticize rather than lead, and that's just part of this business. Seeing no more questions, I want to thank all of you in the media for your efforts to make sure that we get high quality information to the people of our state as quickly and as transparently as possible. And to all of my fellow Mississippians, socially distance, please wear a mask in public. Please stay out of large groups. Together we can make a difference. So thank y'all, and God bless.